Many women over 40 notice intimacy feels different, sometimes uncomfortable, even painful. You might tense up, anticipating discomfort instead of pleasure. This isn't rare, it's a common experience for women in perimenopause and menopause. Vaginal dryness is a biological change, not a personal failing. Too often, women suffer in silence, believing pain is just part of aging. That's a myth. Discomfort is your body's way of asking for attention. Studies show at least half of postmenopausal women experience symptoms like vaginal dryness. Many never report it, thinking nothing can be done. This is a widespread issue that affects quality of life and relationships. Recognizing it as a medical condition is the first step to empowerment. Your sexual health matters, just like any other aspect of your health. You deserve solutions, not silence. In this video, we'll break down the science, symptoms, and solutions, so you can reclaim comfort and confidence. Let's start this new chapter together. Estrogen is the key hormone for vaginal health, keeping tissues thick, elastic, and well lubricated. As you enter your 40s, estrogen levels fluctuate and eventually drop during menopause. This isn't a disease, it's a natural part of aging. With less estrogen, blood flow decreases, tissues thin, and natural lubrication drops. The result? Dryness, friction, and pain. This is called vaginal atrophy. It's a physical change, not a reflection of desire or arousal. You can feel desire and still experience dryness. Understanding the hormonal cause helps separate emotion from biology. The good news? We know the cause, so we can target solutions. It's not you, it's your hormones. And there are ways to help. Vaginal dryness is just one symptom. Others include pain during sex, daily irritation, itching, or burning. These symptoms are often mistaken for infections, leading to ineffective treatments. The urinary tract is affected too. Urgency, frequency, and burning can occur. Some women notice more urinary tract infections after menopause. Physical changes may be visible, thinner, paler vulva, or a tighter vaginal opening. Spotting or tearing after sex can happen due to fragile tissue. All these symptoms are part of genitourinary syndrome of menopause. They're treatable. Recognizing the pattern is the first step to relief. You don't have to guess. Help is available. Estrogen decline is the main cause, but other factors matter. Medications like antihistamines, antidepressants, and blood pressure drugs can worsen dryness. Stress raises cortisol, disrupting hormones and reducing arousal. Smoking impairs blood flow and can trigger earlier menopause. Poor hydration and a processed diet increase inflammation. Long periods without sexual activity can make tissues less elastic. Regular stimulation, alone or with a partner, helps maintain vaginal health. You can't stop menopause, but you can manage these factors. Review your habits and medications with your doctor. Small changes can make a big difference. There are many effective ways to manage vaginal dryness. Lubricants provide immediate relief during sex, water-based, silicone, or oil-based. Vaginal moisturizers, used regularly, restore comfort and elasticity over time. If over-the-counter options aren't enough, local vaginal estrogen therapy is safe and effective. It delivers low-dose estrogen directly to the tissues, restoring thickness and moisture. Minimal absorption means fewer risks than systemic hormone therapy. Options include creams, tablets, or a vaginal ring. For broader symptoms, systemic hormone therapy may help. Non-hormonal prescriptions like ospemifene or prasterone are also available. The key: you have choices. Talk to a knowledgeable healthcare provider. Find the solution that fits your needs and lifestyle. Relief is possible. The emotional impact of vaginal dryness is real. Painful sex can lead to anxiety, avoidance, and a sense of loss. You might feel isolated or less confident. This can strain relationships. Partners may feel confused or rejected. Open communication is crucial. Explain the biological reasons for changes to your partner. This is a shared challenge, not a reflection of love or attraction. Allow yourself to feel and process these emotions. Millions of women face this. You're not alone. Recognize the problem is medical, not personal. Shift from self-blame to proactive problem-solving. Seek information, talk to your doctor, and communicate with your partner. These steps can help you reconnect and rediscover pleasure. Midlife changes aren't just about loss, they're about empowerment. Now is the time to become the expert on your own body. Understanding your symptoms gives you control and confidence. Redefine intimacy. Explore new ways to connect beyond penetrative sex. Focus on communication, touch, and creativity with your partner. Pleasure isn't limited to one act. Advocate for your health. Insist on being heard by your doctor. If dismissed, find a provider who listens and understands. Taking charge of your care boosts confidence in all areas of life. This journey is about reclaiming your body and refusing to accept pain as normal. Your worth isn't tied to hormones. Embrace this transition with curiosity and openness. You're not just treating a symptom, you're writing a new, empowered chapter. Your body deserves comfort and joy. This is your time. Let's answer the questions women rarely ask out loud. Is it normal to be this dry? Yes, over half of women experience it after menopause. It's common, but you don't have to live with it. Should you see a doctor? Absolutely. A proper diagnosis ensures you get the right treatment. Can you reverse vaginal atrophy? You can restore tissue health and comfort with treatment. Local estrogen therapy rebuilds thickness and moisture. Is this the end of your sex life? Not at all. With the right tools and communication, intimacy can thrive. Change isn't the end. It's a new beginning. You have options and support. Menopause and its changes can feel overwhelming, but this isn't the end. It's a transition to a new, powerful phase of life. Discomfort is a call to care for your body in new ways. You now have the knowledge and tools to take action. Relief is possible with lubricants, moisturizers, and medical treatments. Start with a conversation with your partner, friends, or doctor. You are your best advocate. Embrace this as a new beginning of self-knowledge, honest communication, and renewed pleasure. Your body deserves kindness and care. Redefine intimacy on your terms. Support is all around you. This is the start of your next wonderful chapter.